if you have back pain and leg pain along with it, or neck pain and arm pain, or maybe you just have leg pain, do you have a slip disc? Do you have a bulging disc, a herniated disc? You know, these terms get tossed around a lot, especially when we have extremity type pain, numbness, tingling. But what do they really mean? And more importantly, how do you know what's going on and if that's what's the problem in your spine? So that's what we're going to talk about now. So let's address this. It's, again, a very common question and misconception about back pain, about spinal health, because we want to identify the issue so we can strengthen the spine. And of course, what's the lesson? Be your own guarantee, BYOG for your health in your life. So I want to go back to a little anatomy of the spine, because the spine is made up of bones. So those are called the vertebrae. And in between the bones are these discs. They're the intervertebral discs or spinal discs. I'll just say discs because it's easier than saying the whole long thing. So what these are like are, envision a jelly-filled donut, only these are a lot tougher. They're a lot stronger. So the outer layer, it's known as the annulus fibrosus. And on the inside, so that's the donut part. And on the inside, the jelly-like substance, that's called the nucleus pulposus. I don't expect you to remember all of this, but I just wanted to make sure you understood how and what the spine looks like there and what the discs actually look like. And with these discs, it allows your body and spine to move freely. It allows your spine to absorb more stress, absorb more shock. It creates the space between to where the nerve comes out of the hole. It's called the foramen, between where so we got the bones here, all right, the vertebrae, then right here is the disc. And in between those, the connection between the bones and the disc, and even the back part of the spine, the vertebrae, is where the nerve comes out. So now if there's not as much space because there's something wrong with the disc and it's encroaching on that space, well, now that can create the arm pain, the leg pain, or wherever you're feeling that, because the nerves go down the legs from the low back. They go down the arms from the upper back and the neck. So it just depends on where it's coming from. So that's why these hydrated discs are so important for the spine, and we want to make sure we limit the breakdown of them. You know, how does the damage happen? Well, physical stresses that we place on our body, emotional stresses, chemical stresses, they can injure the joint, essentially can wear it down. And that can be a gradual thing. And typically it is, like can wear and tear and cause cracks in the disc, or it can be done suddenly. Very often I hear, and this is a question that I addressed in a previous video, make sure you check that out. I'll make sure you have a link called Hidden Causes of Back Pain, about why we have back pain and why some days we have it or we don't have it one day and then we do the next day. So make sure you check that out. But essentially, we don't have to lift 1,000 pounds one time for us to have a back pain. Or a lot of times the back pain happen, and even damage and injuries to the disc is us having these lifestyle issues where it's causing stress over and over and over again, where it's lifting a pound 1,000 times and it leads to the breakdown. But so you can either have an acute episode where you do lift too heavy of a weight or too heavy of an object, and then your back goes out. It doesn't happen as often as the wear and tear aspect of it, the gradual weakening of the spine. I want to address this because it's a common term, and it might even be more common than bulge or herniated that people ask or mention. They say, I have a slip disc. Well, slip disc is a slang term, so I guess they're halfway right if they know they had a bulge or a herniation, because it essentially means, yes, you have a bulge or a herniation, but there's a difference between those two, which I'll explain in a second, that's irritating the nerve. So very rarely does a complete slip of the disc. So remember, we got the bones, the vertebrae, and the disc in between, and it covers that entire thing. It's not like the disc slips out between it. But what can happen, the most common things that can happen with that are three things. It can become degenerated, bulged, or herniated. So I'll explain each of those just quickly right here. So with a degenerated disc, it loses the moisture. And you can think about that as the start of arthritis. And when you have symptoms, that's when we call it arthritis flare-up. When there's no symptoms, no pain, then it's degeneration is the typical term. So it loses its hydration, it decreases in size, or it gets narrowed, it shrinks, and there's some cracking of the disc. So compare it to like a dried up sponge. So just like a dried up sponge does not have the elasticity of a fully functioning sponge, and it's easier for it to crack and to become broken. It's the same thing with the spine. And typically with a spinal disc or with degeneration, and the typical symptoms in general, again, there's overlapping symptoms with each of these, or it can overlap, but it tends to be more of a dull ache, maybe occasional sharp pains if you move incorrectly, or if you might wake up a little bit more stiff. That is more of a degenerated disc. Now with a bulging disc, so let's go back to the jelly donut analogy. So you have the outer tough layer of the disc, which is the donut. You have the inner gel-like substance, which is the nucleus pulposus in the disc. So with a bulging disc, so now the cracks in that outer layer are enough, that are injured enough, well, the inner gel starts pushing out annulus fibrosis. So remember, that's that outer layer. So when that happens, it can push, it's still intact, but it pushes part of that donut layer into a nerve, into the hole, and can cause dull radiating pain down the leg, down the arm. Again, it just depends on where that bulging disc is in the spine and can irritate the nerves. And it occurs pretty common, and many times you have a bulging disc without any symptoms. There's been studies done showing MRIs of people with no low back pain, and I believe it's 60% of them have a bulging disc. So just because you have a bulging disc doesn't mean you have pain, but that doesn't mean there's not a problem. All right. Just like, let's take blood pressure. You don't feel high blood pressure, but that doesn't mean it's okay. Right. You might have high blood sugar. You might not feel it, but that doesn't mean it's healthy. It's the same thing with a bulging disc, because what can happen is if you continue to stress the disc, stress the spine over and over and over again with the lifestyle factors, with poor posture, with poor diet, not eating enough healthy foods, if you're not getting the right amount of sleep, if you're mentally stressed, if you're sitting too much, bending incorrectly, your body tries to compensate for that. It continues to wear down the disc. Now, let's go back to the slipped. So remember, slipped also means bulging and herniated. So it's both of those. Now, does that mean spondylosis? Somebody asked. So spondylosis actually is more degeneration. Spondylosis is degenerative joint disease. So that can also decrease the space where the nerve comes out. So slipped has to do with the discs, where spondylosis, yes, if we're talking about degeneration and that like arthritis, that's more of the spondylosis. So the last one I want to address here is the herniation. So this is, I want to say the end point, because it could be the starting point for some disc if it just completely, quote unquote, blows out. So this is where that jelly seeps out, where that outer layer is completely injured to a point to where now the outer layers can't hold in that jelly-like substance. And remember, there's chemicals in there, healthy chemicals, but you know what I mean, hopefully you know what I mean, that jelly-type substance, that nucleus pulposus, and now it's more of a chemical reaction, chemical irritation of the nerves. And a lot of times you get sharp, intense pain, tingling, numbness, possible weakness, because the nerves are so fragile. That's why we have the spine protecting them. That's why, the brain is so fragile. That's why we have the skull to protect it in bone. The spinal cord is so fragile. It's a nervous system. That's why we have the spine protecting it. So when it gets irritated and it injures the nerve, well, now it takes longer for that nerve to heal. So that's why we want to make sure you get the right therapy. You want to make sure that you get the right diagnosis or plan of action with that. Now, I mentioned you can have overlapping symptoms, right? You can have pain and tingling and numbness in all of these cases, whether it's degenerated, whether it's bulged, whether it's herniated. They have telltale signs or more common signs with that. And with these, again, I'm talking in generalities here, there are different treatment approaches with them, but it just depends on your case. And yes, it can be complicated. So that's why, I try to provide images here and analogies for that, because it's simple in the fact that, well, how do we address these with our lifestyle, right? The lifestyle that we have with our nutrition, with our sleep, with our mindset, our posture and spinal health. So yes, it can get complicated. I don't want to make it complicated though, because I like to make things simple. And that's why I do these. And I want to make sure you hear these over and over again. I repeat myself because that's where it can start to become uncomplicated. Somebody had asked about bone spurs. Let me address that right now. Bone spurs are the result of the breakdown. Bone spurs happen as a result of the disc breaking down, of the increased wear and tear, and the reaction that gets placed on the bone. So with bones, when they're stressed because of the breakdown of the cartilage, it forms new bone to try to almost fuse and stabilize. So you get these bone spurs coming out, whether it's on your spine, whether it's on your ankles, your knees, your hips, in your hands, hand arthritis. You can get these nodules in the bones because the cushioning isn't there anymore. So now it increases the stress on the bone, creates new bone, and that's what a bone spur actually is. So the different treatment approaches, depending on what type of problem that you have with the disc, if it's degeneration, exercise, nutrition, posture, and lifestyle changes are especially important. And, we talked about that in a previous video, right? Previously is what arthritis is, that degeneration, how to improve that lifestyle. So again, I'll make sure that you get a link to that video or go back and watch the previous one that we did on back talk. Bulging disc. So this is a good spot for corrective chiropractic care, and the technique that I love, and even spinal decompression, which helps take the stress and creates a gentle stretch and more separation and space for the nerve to come out and allow the disc to heal. And then, so that's decompression and corrective chiropractic care. Again, what I use is called chiropractic biophysics. They're the leaders in the research in this technique, and also spinal health and how we can take stress off of your spine so you can strengthen it and make sure it doesn't break down, or it definitely slows the breakdown. We want the whole body approach, and that's what we do with CBP. Now, with herniations, we want to try conservative care first, whether that's physical therapy, chiropractic biophysics, exercises, nutrition. They're always going to play a role. Lifestyle factors are always going to play a role with each of these. It doesn't, I'm breaking it down into degeneration versus bulged versus herniation, but we always want to try conservatively first. But with a herniation, a lot of times that does require surgery. I know in our office, and over the last 24 plus years of me doing this and being in practice, if conservative care doesn't work, there are signs where if spinal decompression does not feel good while you're in it, or even after a few visits, if it doesn't feel good, then we know, okay, that's probably a herniation and they're a candidate for surgery. So those types of signs to let us know that. And I'm not sure if that's happened to you, but that's those types of signs and symptoms that you can pay attention to. Last thing I just want to mention, if you want the spinal hygiene mini class that touches on and explains how to take as much stress off of your spine and your discs as possible, type in spine in the comments and I'll make sure I get that to you. And then I'll also, again, I'll put these links in the description as well.